Hi, my name is Jennifer Miller, and I'm a graduate student at Maryville University. This is Erica, and she's going to be my patient today. We're going to do a head-to-toe assessment. Before Erica came in the room, she was prompted to empty her bladder and change into a gown. The nurse did obtain vital signs from her, which were normal. Her height is 5'1", her weight is 115, which is normal for her gender and her age. So we are going to go ahead and start the assessment. So I'm going to start by just doing a general inspection to make sure that there isn't anything that's sticking out that I need to assess later, that her color is normal. I'm going to go ahead and check scalp and just feel for any bumps or lumps that shouldn't be there. Hair is normal. I'm going to feel some facial bones. So we're going to check the trigeminal nerve by feeling the temporomandible joint. So go ahead and open and close. So there's no popping or anything here. Ears and everything look normal. We're going to check her facial nerve, so I'm going to have you puff out your cheeks, smile for me, okay? Squinch up your forehead, okay, close your eyes tightly, stick your tongue out for me. So that comes out midline and there's no issues there. So I'm going to go ahead and grab a light. So I've got the ophthalmoscope. I'm going to use this light. So I'm going to go ahead and look at your eyes. I want you to go ahead and just look at something on the wall, and I'm just going to check the conjunctiva and the sclera for normal color. So it looks good in pink there. I'm going to have you look over to the side, look back, look down, and look up. Alright, so that looks good. Sclera is white, conjunctiva is good in pink, so everything looks fine there. I'm going to check your pupils. So I want you to look at a spot on the wall. So I'm checking to make sure that you have a pupillary response, and then I'm going to check the other side as well to make sure that you accommodate. And you do. We're going to go to this side. And then one more time to check for accommodation. Alright, while I've got you here, we're going to go ahead and check oculomotor. So I'm going to go ahead and do a cardinal field of gaze. So I want you to follow the light with your eyes only, not your head. Nice job, and that looks normal. So now I want you to follow again. We're just going to go back and forth here, so follow the light. Checking for nystagmus, and that also looks good. I'm going to go ahead and do a sensation. So I want you to close your eyes, and I'm going to touch you on the left or the right side, and I want you to tell me where I'm touching you.
Left cheek.
Okay.
Right cheek. Left chin. Right forehead. Left forehead. Right chin.
All right, nice job. So we're just checking to make sure that she's got the good sensation on her forehead. All right, so I am going to look actually in the eyes. So I'm going to turn this light down. I've got a small light on. There we go. So I'm going to check the optic nerve. So I'm going to come in from this side. So we're checking the red reflex. And coming around and checking the optic nerve. That looks good. We're going to do the other side. Okay, perfect. Go ahead and turn these lights back on. All right, I am going to grab the otoscope here. We're going to move on to ears. So we're checking the vestibular cochlear nerve here. Make sure I've got the light on. So I'm looking at the outside of the ears. Everything looks fine with the auricle. I'm going to go ahead and pull this back and up. I'm going to look here. So eardrum looks a good pearly gray. Pull that up. I'm going to come to the other side. Again, the outside looks fine, no issues there. This in here. And same thing, just an opaque pearly gray on that eardrum. All right, so we're going to do a hearing test. So I've got a tuning fork here. We're going to do a Weber hearing test. So what I'm going to do is I'm going to vibrate the tuning fork. I'm going to put it on the top of your head, and I want you to tell me if you can hear it bilaterally or one ear or the other.
Both ears.
can hear it both ears? Perfect. Okay. We're going to do this again for each ear. This time it's called the Renee test. We're going to put the tuning fork right back here on the bone. We're going to listen for bone conduction. I want you to tell me when you can't hear it anymore, and then I'll put it in the front of the ear, and you should still be able to hear it. I'll tell you, and I want you to tell me when you can't hear it, and I'm going to be timing you.
Can't hear anymore.
Okay. Now tell me when you can't hear it here.
I can't hear it anymore.
Okay, I'm going to do the other side. Same thing.
I can't hear it anymore.
Okay. And tell me when you can't hear it here.
I can't hear it anymore.
Okay, so what we wanted to see is that when you are listening through air conduction, it's actually doubled from the bone conduction, and that's what yours was. So that's perfect. So again, that was the vestibular cochlear nerve on that one. All right, so I'm going to go ahead and take this otoscope back, and I'm going to check your nose. So I'm looking at the outside. Everything looks fine on the outside. Going to palpate and make sure that there's no tenderness here on the nose. Anything there? No? Okay. So sinuses are good. Looking at the outside, it looks like the septum is midline and not deviated at all. So I got the light on. So I'm going to hold the back of your head, and I'm actually going to tip you up, and I'm going to get this close and tell me if I hurt you. So what I'm looking for is the turbinates, and I can see those. And then I'm going to look at the septum, which looks fine. I go to the other side, sorry. Same thing on this side. I'm looking at turbinates. They're a pink-red color. Looking over at the septum, and that looks good too. So nose looks good. Get rid of this light. I'm going to throw some gloves on real fast, and we're going to go ahead and check the mouth. So I'm going to be looking at the buccal mucosa, looking at your gums, checking the tongue, the tonsils. Let me grab a tongue depressor here. Okay. So go ahead and open and say ah.
Ah.
All right. So I'm looking around. I want to check both sides of the mouth. Go ahead and lift the tongue up. I want to look under the tongue. We have a tendency to have cancers that hide on those margins there. Gums look good. Go ahead and open and smile. Good job. Open again. I'm going to check your tonsils. So tonsils look about to be 1+. Say ah again.
Ah.
Okay, ah is good. I'm going to check your gag reflex. Okay, sorry, I hate to do that. So that there we were checking cranial nerves 9 and 10. So the glossopharyngeal and the vagus nerves, and that's all good. So I'm going to actually leave my gloves off here. I'm going to check the neck. So I'm going to go ahead and feel lymph nodes. We're going to check the trachea, carotids. Sorry, I have this all wiped in. All right, so I'm going to start here. I'm going to start with your lymph nodes. So we're going to do preauricular lymph nodes. And then I'm going to go down to the tonsillars. Back here, we're going to do postauricular, occipital lymph nodes. We're going to come down. There's a cervical chain back here. We're going to check this anterior chain, submandibular, and then the submental. I'm going to go ahead and pull this gown forward and let that, and I want you to shrug your shoulders forward a little bit so that we can check these supraclavicular. So these are super important to check and make sure that those aren't inflamed as well. I'll go ahead and pull this back up. So now I'm just going to go ahead and feel the trachea. I want to make sure that this is midline, and it is. We're going to feel jugular veins here. And then I'm going to do the carotid. I'm going to do that carotid one side at a time, just so that we don't occlude any flow. Okay, I'm going to feel for thyroid. Okay, I'm going to go ahead and listen to your carotids. I'm going to do this with the bell of the stethoscope. Okay. Okay. Other side. Okay. Now I'm going to come behind you and I'm going to go ahead and listen to your thyroid. And what I'm listening for is that there aren't any kind of vascular sounds, which can mean that you have an enlarged thyroid. And that looks good. Alright, so lymph nodes are good. Neck is good. I am going to grab a pin here. Pull this over. Alright, before we have you turn, I'm going to go ahead and pull this up, actually. And I'm just going to check upper extremities. So what I'm looking for is symmetry on both sides of muscle mass, color, hair, and temperature. I'm going to check skin turgor, which looks good. Checking capillary fill. And that looks good. No clubbing of the fingers. I'm going to check brachial artery. And we're going to check a radial pulse. Okay, other side. Radial. And brachial. I'm going to go ahead and grab a reflex hammer and we'll check that brachial reflex. So I want you to relax this arm as much as you can. And we got it there. Other side. Try to again relax that arm. And we felt it there right away. Alright, perfect. So I'm going to have you turn actually to the front here and square your back up. So we're going to listen to lungs. I'm going to percuss the lungs. I'll also do some palpation. So what I want you to do is I'm going to put my hands on your back and I want you to say 99.
99.
So I'm checking for tactile firmness. Again.
99.
Again.
99.
And again.
99.
Okay, nice job. So we're going to do some percussions. I'm going to do the costovertebral angle. So we're about here. Check it on the other side. I'm percussing that with the ulnar side of my hand. Alright. So now I'm going to check diaphragmatic exertion. So what I want you to do, whenever we start, I want you to take a big deep breath in, and then you're going to take a big deep breath out, and I'm going to percuss while you're holding that breath out. So big deep breath in and out. Okay. I'm going to mark a little mark on your back, sorry. Okay, this time I want you to take a big deep breath in, and I want you to hold it in. And hold it. So we're listening. Okay, so we're back up here. You can let it out. Sorry. Okay, we're going to do the exact same thing on the other side. So big deep breath in. And let it out. Sorry. And then one more time, big deep breath in and hold it. Go ahead and let that out. So I'm going to measure here. Let's see. So we're measuring about 4 centimeters on this side, and about 5 on this side. So 5 is normal. This side is a little less than normal, and that's okay. All right. This back. I'm going to go ahead and listen to your lungs now. So I'm going to kind of just go side to side, listening. I want you to breathe normal for me. So. Alright, so side to side, everything is equal bilaterally. Alright, so I'm going to have you actually, I'm going to come around and I am going to listen. I'm going to actually feel for tactile firm. It is also in the chest area, so I want you, put my hand on your skin, sorry, my hands are cold. I want you to say 99 again.
99.
Okay.
99.
Okay, I want you to take a big deep breath in and let it out. So I'm just looking for evenness on both sides. Okay, I'm going to go ahead and listen to you again. Let's turn that way. So I'm going to listen again side to side just to make sure that everything sounds even. Okay. I'm also going to listen to your heart valves. So I'm going to start. We want to listen to the mitral valve, the aortic valve, and the tricuspid valve. So, I'll bring up here, sorry. And then we come down onto that right side a little bit for the tricuspid valve. Now, go ahead and have you pull that back up, sorry. I will go ahead and have you lay back on your back. We're going to go move to your abdomen. So lay down, if that's comfortable for you. I'm going to pull this up. So the first thing I'm going to do is I'm actually going to listen to vowel sounds. So we listen to those in 4 quadrants. So active vowel sounds. In all 4. Okay. Now I'm going to listen to your arteries. So I'm going to listen to the aorta. So we're listening for any bruits. And then we also listen to the renals. We'll listen to the iliacs. And then we'll also do femoral. So I'm going to come up here. Other side. All right. Sorry about that. Okay. So now what I'm going to do is I'm going to percuss your organs. So what I'm checking for is the liver, your spleen, and your kidneys. So we percuss. And you can tell, you'll hear a dull sound when you're over those organs. So we're going to come over here for the spleen. I'm going to palpate lightly. And I'm going to palpate a little deeper, so we kind of go up. And other side. So the spleen, on this liver, you can feel the liver edges coming down. I'm going to go ahead and feel for those kidneys. So I'm going to put one hand back here and palpate deeper on this side and here. All right. So that looks good. So I'm going to go ahead and pull this down. I'll go ahead and have you sit up. And we're going to check your lower extremities. You can hang your legs over the side. I'm going to raise the bed up a little bit. So what I'm looking for is I'm looking for muscle mass again, color, temperature bilaterally to ensure that everything is equal. Alright, so I'm going to grab the reflex hammer here again. So I'm feeling this feels normal. I'm going to go ahead and check reflexes in the knee here. So that one's good. Alright, I'm going to check back here on the Achilles. So I just want you to relax your foot in my hand. Oh, there you go. And other side. Alright, I'm going to go ahead and check pulses also. So popliteal, I'm going to go ahead and hands here, go ahead and relax. Okay, other side. I'm going to check posterior tibial pulses. And then pedal pulses. Okay, I want you to check strength